order. We'll begin with a roll call, please.
Commencing roll call, Vice Chair Blair Whitney.
Here.
Councilmember Juan Carlos Prado. Councilmember Everardo Rodriguez. Councilmember Niket Searcy. Councilmember Kathleen Daly. Councilmember George Salmon. Chair Brooks Esser.
Here.
Thank you.
Agenda item number 2, public comment. Anyone may speak up to 2 minutes on any topic not on the agenda. Please note that the council may not discuss or take action on items that are not on the agenda this evening. Do we have any public comment?
Members of the public may comment on any topic that is not on the agenda. Please bring your speaker slip up to the clerk during this time. Each person will be granted 2 minutes to speak. No public comment. Back to you, Chair.
Thank you. Okay, moving right along. Agenda item number 3, briefing and discussion on county health COVID update. That discussion is going to be led by Trish Irwin of the San Mateo Medical Center, as well as Veronica Landa from Family Health Services of San Mateo County. Trish, the floor is yours. Please, if you'd like.
Good evening, everybody. As Brooke said, I'm Trish Irwin. I work with San Mateo County Health. Right now I am the clinics manager for Fair Oaks Health Center, which is right down there, and Sequoia Teen Wellness Center over on James. And prior to that, I was heavily involved in the county's COVID-19 response through from March of 2020, through all the vaccination efforts and testing efforts. So I'm joined tonight by my colleague Veronica Landa, who I guess won't show up on. You won't see her. Okay, that's okay. You'll hear her though, because she's going to go over a kind of current state of where we are with the COVID-19 vaccine, what's kind of happening. I can talk a little bit about what we're seeing in hospitalizations right now and any other indicators for COVID in the community right now, and just kind of where we are with the medical sector. So, Veronica.
Yes. Hello. Can you hear me all right?
Yes. Yeah.
Great. All right, so I'll take it away. So as Trish mentioned, my name is Veronica Landa. I'm the manager of the San Mateo County Immunization Program. So why don't we just jump into some updates about COVID-19 vaccinations. So first I just wanted to give a quick recap of where we left off at the end of the last big COVID vaccine push. So these are some vaccination rates for North Fair Oaks as of April 2023. So that was that 90% of the population had received at least 1 dose, and 21% had received the bivalent booster, which was usually considered up to date. After April 2023, that's when community clinics that were operating as part of the emergency response ended, and the reporting can change to being tracked more at the zip code level by the state. And since then, there haven't really been any big efforts around vaccination, so this is kind of the most updated information available for this specific region. So now I want to turn to kind of what's new for this season. This is the first season since the pandemic that the immunization program's not operating COVID vaccination clinics as an emergency. The pandemic kind of changed a lot about how we think of and understand vaccination in the community. It really highlighted vast and persistent health disparities among our residents and emphasized San Mateo County's role in addressing those inequities and fulfilling our safety net mission. So yeah, okay, so the next piece is around approval and recommendation of the new COVID-19 vaccine formulation. Last week, the CDC officially authorized and recommended the new vaccine. So we'll take a closer look at that recommendation in a moment. The other new thing I wanted to highlight is the commercialization of the COVID-19 vaccine. So what this all means is the federal government is no longer purchasing and distributing vaccines. That is what previously enabled vaccines to be distributed for free at any location during the emergency. Without that, this year, the vaccine is flowing through regular commercial pathways. So that means that most providers are going to have to pay for the vaccine, be reimbursed through insurance. And that means that the pathway for insured residents to access COVID vaccines will be primarily through their primary care providers and their pharmacies, similar to how they'll access any of their other vaccines. Uninsured children are covered through longstanding Vaccines for Children program. As long as they're going to a VFC provider, there should be little to no cost, but that did leave a gap for uninsured adults. So this year, the Bridge Access program was established for adults over the age of 19 who are uninsured or whose insurance doesn't cover vaccines. And there's a couple things about this program since it's brand new. It does require an eligibility screening to make sure that the people who are receiving that vaccine are uninsured or underinsured and that they're the right age. Medi-Cal recipients are not eligible. There is a strict kind of enrollment requirements for providers, so there aren't very many Bridge Access Program providers. The allocation that's available for the entire county of this vaccine is also really small. There's only about 4% of the county that's uninsured, so the total allocation kind of reflects that. Oh, and there's been a question about whether or not Bridge Access Program vaccine would be available at pharmacies, and it will, so that's fortunate. A lot of this is getting set up still, so availability is a little bit spotty as it's getting rolled out, and actually pharmacies have more access in these early days of the program. Okay, so I'm going to turn back to recommendations. So San Mateo County health officials are urging residents 6 months and older to get seasonal flu vaccines and the updated COVID-19 vaccine, which again was approved just last week by the CDC. The CDC also recommends getting the flu and COVID vaccines at the same time. Dr. Kismet Baldwin-Santana, who's the new health officer for San Mateo County, also said that if you are eligible, this is a good time to get both the influenza and updated COVID vaccines to help protect you from severe illness and hospitalization in the upcoming respiratory virus season. I think for more specifics about the recommendations or dosing schedules, you can go to the CDC website. Okay, so let's talk a little bit about how people can access free vaccines. So for insured residents, again, adults specifically going to their primary care providers and local pharmacies is really a thing to do. For uninsured residents and underinsured residents that are adults, again, 19 and plus, local pharmacies are going to have access to that Bridge Access Program vaccine. Other Bridge Access Program providers probably will have some, regular kind of clinics. There will be a small number of kind of pop-up community clinics through the county. We are focusing our efforts this year on a small number of community-based clinics that are targeted more for uninsured and underinsured people, like within those health equity quartile areas, and they will provide both flu and COVID vaccines. More information about that's also going to be on the website, and it'll be updated regularly since clinic and vaccine availability are kind of changing frequently at the moment. Children, again, can access COVID vaccines through their primary care providers or VFC providers. Okay, now specifically for North Fair Oaks, I did want to highlight a couple of upcoming opportunities for the community to get vaccinated. Again, this information is going to be on the website and circulated through the community, but I did want to emphasize there's a couple of clinics at the North Fair Oaks Library on October 14th, and then they're at the Fair Oaks Community Center Tuesdays from October through December, kind of in the mornings. And did just kind of want to emphasize again that the pop-up community clinics are targeted for uninsured and underinsured adults. However, flu will be available to any attendee that's over the age of 2, regardless of their insurance status. And COVID-19, again, is available based on eligibility and what we have on hand in terms of supply. And Trish, I'm not sure if there's anything you wanted to add specifically about Fair Oaks Health Center.
For the San Mateo Medical System, San Mateo Medical Center system, we are going to start issuing a flu vaccine as of Monday. We do not yet have the COVID vaccine on hand or have a process for that. That requires training for our nurses, getting it into our electronic health record. So we have flu starting on Monday, and then what we'll plan to do throughout the fall season is we usually hold weekend clinics for flu and for COVID for adults, and then also for expanding some of our vaccine accessibility for our pediatric teams as well. So we'll just continue in that vein throughout the fall season. Back to you, Veronica.
Great. That was all the information that I had for today. If there's any questions.
Do we have any questions from council members?
It's a little slow to roll out, right? They got us pretty excited that we start looking around and yeah.
I've seen it. I was at my own pharmacy the other day, and I think they already had scheduled for it. So we tend to get a little slower into the health systems and stuff, but It is out there and it's a new, I believe, Veronica, it's a monovalent and it's targeting the new strains that have been out for a while now.
Right. Yeah, exactly. And I think it is, because of commercialization, having to set up all the billing systems and is taking a little longer than people I think anticipated, but yeah, you're starting to see it trickle into places.
Is prior to this, everything was free. So if you think back to the mass vaccination events that we did in early January, throughout 2021, that was all free vaccine, came in through the local health jurisdiction, which was us, County Health. And then we pushed it out into the community, right? And then Sutter, PAMP, Kaiser, they started getting their own. Initially, it all came through local health jurisdiction and we sent it out to everybody else. Eventually the flow went directly to the other healthcare providers and stuff like that. But that shift, as Veronica said, is from it's no longer an emergency. So it's no longer the federal government purchasing the vaccine. It's now going through a process in which you have to get reimbursed by insurance. And that's something that we didn't do throughout all of COVID. We never collected insurance information to be able to help bill insurance providers. It was all on FEMA and the county general fund.
Commercialization, does that mean some drug company is making the profit off of selling the vaccine? Is this one company that has
I
it?
think it's still Pfizer and Moderna. I don't think who makes what's the N one? The Veronica.
Novavax.
Novavax,
Yeah,
yes.
it hasn't been, I think, completely authorized yet, but likely soon.
So Pfizer and Moderna have been making a lot of money off of this all along, right? Because they've been being paid by the federal government. So this just means the funding mechanism will now have to, rather than the feds paying directly, going through insurance companies such as Aetna or Blue Cross or whoever you have to pay back.
And for the uninsured, who do we have, or is there, what's the process for that? Is that just through our funds or?
Well, so
Yeah.
for children, every child in San Mateo County is covered, right? We put them all on Medi-Cal. But Veronica, it's called the Bridges program.
Bridge Access Program. Yeah, that's what was established this year for uninsured and underinsured adults. So it
Is
should
that-
cover them. But there are, it's a limited supply and limited providers that are able to provide that.
Is that a government program or is that a private one that's offering the?
It's a federal program.
Okay, thank you.
Other questions from council members?
We are seeing a slight, just for information, the hospitalizations in the county right now, as of the 14th of September, we're at 14 COVID hospitalizations. The high we've seen since about mid-August is 30, which is about 2 weeks ago in September. Wastewater was, the sewage rates that we see in the wastewater data are trending up again right now. They had gone below where we'd be worried about it. It's going up a little bit again. At my clinic, I'm seeing COVID go around a lot more frequently amongst my staff in particular, and in the folks who are coming in and stuff like that. So we all also trying to get some COVID, over-the-counter COVID tests for our patients at the Fair Oaks Health Center as well, that we're distributing.
Sorry, how does that compare to the hospitalization rate, maybe like towards the later end of the pandemic time period?
I mean, the later end or the height? I mean,
Either way.
the height of the pandemic, because I was working with the discharge planning team. We were rocking about 200 to 250 people in the hospital, and we set up an additional 8 ICU beds at one of the hospitals that we brought in. And so our ICUs were maxed out at the time. We went from, like, if you think about the fall of 2021, there was a lull like early October, and then it just started as we went into Thanksgiving, it started doubling. So 20 to 40 to 80 to 100 to 120. It was like just skyrocketed basically up through like January, February 2021 was the worst. And then it's come down, but we've had spikes since then.
Other questions from council members? There are no prerequisites for the new vaccine. In other words, if you're behind or not fully
No.
dosed up, you can still, okay.
It's a bit of a clean slate. So to be up to date, I think in this new season, it's just receiving the new vaccine.
Mhm.
What about if someone's had COVID recently, Veronica? Do they have to wait any amount of time?
It is recommended that you're waiting at least a couple months before another dose.
If you get COVID, you're boosted, right?
Okay.
It's like when our parents, when we got chickenpox, our parents got boosted, right? For chickenpox. That's why shingles is more prevalent now because our kids don't get chickenpox anymore, right? So we don't get the boost anymore. So we have to get the vaccines now ourselves as adults. So that's kind of, COVID gives you a little bit of boost for 2 to 3 months. And then we should definitely consider getting the new vaccine when it comes out and the flu shot as soon as possible. So,
Do you know of any specific outreach that's being done for the most vulnerable? And I'm thinking seniors in particular. Are we getting out there and saying, it's just one shot, folks, and you're good to go now? Instead of,
Veronica, do you know if Aging is doing anything or if we're doing any kind of, any congregate support or?
We are not doing the congregate program anymore. Aging's got their homebound program, so they're going out to individuals who are homebound to deliver both flu and COVID vaccines. I don't know specifically about their outreach strategies, but I can ask about that and get back to you.
that would be good. I was particularly concerned about seniors who get hit pretty hard with this.
A pretty robust program of
Mhm.
outreach and congregate that we did, up until probably February, March of this year, Veronica.
Yes,
And then we
longer
had-
actually. I think we went through June, but it was trickles by then.
So the way the county works, Family Health Services has the immunization program, so that's why we were heading up all the vaccination efforts. But Aging and Adult Services is the traditional service or county division that would be reaching out to seniors and stuff like that. So they've kind of taken it back and are doing more delivery of COVID and flu vaccines moving forward.
Are you attending any of the community events that are happening now, or
Are we meaning like the COVID?
anything from the health side? Like there's community events that are happening, kind of like fall
I
event.
don't know. I mean, I just held a community day at my clinic on Wednesday, so I brought in a bunch of services to Fair Oaks Health Center. We had about 20 different community-based organizations.
So that's something at the clinic, right?
Yeah.
But if people are having like fall get-togethers, end of summer barbecue parties, like block party, community organized events, or
You can always reach out. I mean, Veronica, what the ways to reach out to see if there was any tabling or anything that someone could come out and do. We wouldn't be, I think they're limited, as Veronica was saying, on providing vaccines at any events like that.
not vaccine, but more like just information. Hey, this is available, go here.
I see.
Or like even flyers to provide at some of these
We can
events.
follow up with our public information officer on that, what they're doing. They do a lot of Facebook posts and stuff like that for the help. If you're not following, you can follow.
Last call for questions from council members.
Other than you guys made it pretty easy to find the vaccine. You did a great job.
Thank you. Thank you.
Driving into the event center was something I will always remember.
Yes,
Hmm.
yeah. I was there at every single vaccination clinic at the event center in SFO.
Yeah, that was impressive.
Yeah.
Thank
It
you.
was definitely a collaborative effort between the Sheriff's Department, the Health Department, and our Human Services, some other folks that we worked together. So it's a huge collaboration. The county really came together for it. So proud of those efforts.
Do we have any public comment on this agenda item?
Members of the public, if you wish to comment on agenda item number 3, briefing and discussion on the county health COVID update, will be granted 2 minutes. No public comment.
Okay, well, thank you very much.
Thank you.
Thank you, Trish
Thank you.
and Veronica, for your information.
Thank you. Thanks. Have a good evening.
Thank you.
Item number 4, briefing and discussion on the opioid and fentanyl crisis in San Mateo County. That discussion is going to be led by Edith Cavasley, along with Michelle Sudaika and Mark Ross of Behavioral Health and Recovery Services.
Sure. Good evening, members of the council. My name is Edith Cavasley. I come to you from Behavioral Health and Recovery Services. With me this evening are 2 people. You see one, the other's online. So the first to speak will be Michelle Sudaika, who is from our AOD prevention program. And after Michelle will be Mark Ross, who is with our integrated medication assisted treatment program. We will have time for your questions afterwards, and we'll start with Michelle online.
Awesome. Thank you, Edith. I assume everybody can still hear me correctly.
Yes, we can.
Perfect. Okay, so the fentanyl crisis, what you should know. So this photo in the main slide is something that we will be discussing a little bit later. So keep an eye out for that. Next slide, please. presentation overview, we're going to be discussing reasons people use substances, defining substance use disorder, signs and symptoms of drug use, some basics about drugs with a focus on opioids and fentanyl, some harm reduction techniques and definition, treatment options, prevention strategies that we're doing here in the county, and what you guys can do as community members. So this is the continuum of care. It's it shows the stages of healthcare services that an individual might receive in relation to an adverse health outcome. So there's 3 stages: prevention, treatment, and continuing care. So prevention is the first 3 wedges of this half circle. And it's everything that is prior to a diagnosis or adverse health event. So think diagnosis of a substance use disorder, or if you're looking at it for other conditions, cancer or heart attack, if that's easier to help illustrate this for you. So in prevention, we educate individuals to try to keep them from having the adverse health outcomes. So in our case here, substance use disorder. Treatment ranges in the middle of this half circle, and it goes from illness identification through standard treatment. And then we have continuing care. So after you're done with treatment, you're not just done with it, there's management of the illness and relapse prevention and rehabilitation. And along every stage of this continuum, we have mental health promotion. So we promote mental health and healthy lifestyles at every stage. Next slide, please. Perfect. Okay, so why do people use drugs? There's so many different reasons, but some of the main ones are stress and anxiety. Maybe they're in pain, so they take a pain pill. Boredom, they have a health condition that they're prescribed a medication for. They're depressed or sad. For our youth and even for adults, there is peer pressure. Everybody's doing it, they want to fit in. They don't want to feel how they feel anymore. They have trauma that they are dealing with, and this is their method of dealing with it. Or they see celebrities, your influencers on social media, doing drugs, drinking, or they have friends and family that they see the behavior modeled from. To define a substance use disorder, it's a disorder that affects a person's brain and behavior, causing an inability to control their use. So how does this happen? Well, repeated drug use over time can lead to physical changes in the structure of the brain and how it communicates with itself and the rest of your body. These changes can be long-lasting and are what lead to addiction and can cause relapse. So it's not always the person's choice to continue because of the changes that have happened to their brain. Risk factors for substance use disorder. This is one of those things that can happen to anyone, no matter who you are, where you live, and what your background is. So anybody, age, sex, economic status, anybody can become addicted. There are some things that are have an effect on the likelihood and severity of addiction. So family history, if you have a mental health disorder, peer pressure, who you're hanging out with. If your family isn't very involved in a youth childhood, that can be a risk factor. Early use. So the earlier you use, the more likely you are to develop a substance use disorder, and then taking a highly addictive drug. With that said, just because you have all of these risk factors, or many of them, or none of them, doesn't mean you will develop a substance use disorder. It just kind of depends on the person. Next slide, please. Signs of drug use. So there's different signs for different substances. Bloodshot eyes, so really red eyes is a sign. For opioid use, we look for pinpoint pupils, so the pupil is really, really small, or with stimulants and stuff like MDMA or mushrooms, you'll see dilated pupils, so the pupils will be really large. An individual will appear sleepy or sluggish. They'll have reduced motivation. Sometimes there's a change in personality. So, people reference roid rage for steroids. That's a change in personality. Difficulty focusing, and then distorted sensory perceptions. So sometimes they'll have hallucinations and stuff. Next slide, please. Effects. So there's short-term and long-term effects for all of the drug types. For alcohol, your loss of coordination, slurred speech, disorientation are your short-term. Long-term, it can result in dependency, liver cirrhosis, increased risk of cancer, and increased risk of bodily injury. Cannabis is, for short-term, is, slowed reaction times, delusions, increased appetite or thirst. We've all heard of the munchies. Long-term, it can cause psychosis. It can cause depression and anxiety, cause memory problems, and lower IQ. Opioids, short-term can be good for individuals who have pain because it blocks pain. It calms your mood, but can cause itching and constipation. And then for long-term side effects, there's intensified pain, hormone imbalance, and slow and ineffective breathing. Next slide, please. We'll turn it over to Mark.
All right.
Yes, please.
I won't sing, I promise. Hey, so I'm working with the Integrated Medication Assisted Treatment Team, otherwise known as IMAT. In a nutshell, what I do is case management. We do interventions in an emergency room, make connections with the patients there, link them to an outpatient clinic that does medications that help with cravings. And then we try to stay connected with them to keep them engaged. So opioids, you've got your list there. Those are pretty much the most common ones. The most dangerous one right now is fentanyl. Generally, a lot of times people think they're taking one of the other opioids, and really what they're taking is fentanyl, because there's a lot of bootleg pills and things out there. And it produces, obviously, it's initially was meant to be for severe pain, but the side effect is euphoria. The more intense drugs on the list produce more euphoria. The more you use, the more you need to use in order to have the same effect. Next slide, please. So acute pain relief, surgical care, fentanyl, I believe is mainly initially used for people with cancers with really severe pain. It, as you heard before, it can cause constipation, so it's great for suppression of diarrhea. There are opioids that are used for medication to help people get off of opioids. So Suboxone or buprenorphine is a wonder drug that doesn't have the risks of fentanyl. So just to stress that not all opioids are bad. They have their uses. Buprenorphine is great. It has a ceiling effect and you can't really overdose on it, unlike fentanyl. And then if you've ever had that syrup they talk about in the rap songs, that's the one that suppresses the cough. Next slide, please. So the brain is built for opioids. Opioids are built for the brain. That's probably why they work so well. You have receptors in your brain that those things just grab right onto. the receptors can alter the way that the pain signals are sent. So they're actually not killing the pain. You're just kind of not noticing it as much. But they also affect how the brain feels pleasure. So you do feel obviously a euphoric feeling, as well as I'm sure you've seen people nodding off and falling asleep. It does cause pretty heavy sedation. Next slide, please. Okay, so some short-term effects. I mean, the main one you're going to see is the nodding. You'll also see when people are in withdrawal, you'll see irritability, nausea, vomiting. They'll have chills, body aches. But during the intoxication stage, you may also see nausea and vomiting. The drowsiness, usually sometimes people get cold, sometimes people get hot. You might see people doing the agonal breathing. It sounds like snoring. Usually that's an indication somebody needs some Narcan pretty quick. Next slide, please. So this slide, I have mixed feelings on this slide. So fentanyl is super dangerous, and that amount next to the penny is enough to kill a person. But that being said, there are clients that I have that'll do an amount the size of the penny and be fine because they have a tolerance. They build up a tolerance. So it's complex. You don't want to panic about it and say, oh my God, if I touch a piece, like I'm instantly going to die. But at the same time, a small amount can be dangerous. So like that amount, if you think about it, if somebody's doing a counterfeit medication that they think is something safe, and it's got that amount of fentanyl in it, they could overdose and die. It's way stronger than heroin, 100 times stronger than morphine. Generally, we see it in a powder form lately. But again, there are other forms, patches, lozenges I haven't seen myself, but something that comes to mind too is with the appearance of it I've seen lately is it often brightly colored, and then the different colors have different strengths. So you might see a yellow batch, a purple batch, a pink batch, and it looks like something fun for kids to play with, which is really scary. I've seen photos from the Tenderloin where the police have done roundups, and oftentimes it's going to be in a little cellophane or a baggie, and it's going to be a colorful powder. Next slide, please. Okay, yeah, alternative pain treatments are definitely the way to go. Sometimes you need opioids. We used to think in the addiction field that morphine was something to be avoided at all costs. And now it's like, no, take the morphine. You know, it is definitely way safer than the fentanyl. And if you're in severe pain, you're going to probably need opioids. Don't keep extra pills at home. If you can get by without taking an opioid, your doctor is probably going to know if you need one or not. If you can get by without taking one, don't take one. The extra pills at home thing, I think is really important because sometimes people get started just by dabbling. They find something cool in a medicine cabinet and they try one and it's like, oh, well, that felt nice, you know? And then they find out that they can get something like that somewhere else, like in the Tenderloin or wherever. More money for prevention and treatment, yeah, for sure. We definitely need that. And we need to reduce stigma and just be able to talk about the issue. A lot of people are shy about discussing. And don't buy your drugs off the street or online. Definitely, you're going to get counterfeit drugs 9 times out of 10 if you buy it on the street. And kids, you know, they want to buy it on the street because the doctor's not going to prescribe it to them. So kids are probably the most at risk from the street drugs. Next slide, please. So there's some locations you can drop off your medications if you don't finish the bottle. Definitely recommend doing that and not keeping them in your house. Next slide, please. Harm reduction, great. So that's what we do with my program. We don't tell people they necessarily have to stop using. We'll meet them where they're at. Some examples of harm reduction: sunscreen, seatbelts, speed limits, birth control, cigarette filters. So, you know, you don't tell somebody, don't ever drive a car because you might die. You know, it's not really realistic to expect that. If you're gonna drive the car, wear your seatbelt so there's less chance that you can die. Harm reduction comes in a lot of other shapes and sizes. Medication-assisted treatment is a big one. Suboxone, while it is an addictive substance, it can be a life-saving substance to get somebody off of fentanyl, which could be super risky. I think the non-stigmatizing language is important to just glance at. We use people first language in the hospital, especially if I'm talking to a patient that has schizophrenia. I don't say, hey, let me speak to John. I call him a person that has schizophrenia versus like, oh, he's oh, he's an addict. You know, no, he's a person with a substance use disorder. And I think things like that, if you practice them, will help if you have to engage with somebody, because if you come at them and you're trying to talk them out of getting into trouble with drugs, the last thing you want to do is immediately offend them, you know, with your first statement, like, oh, well, you're a dope fiend, you know, let's discuss, and they're gone. Your chance to have a conversation is over. Urinalysis. I believe that that a lot more people are doing home drug tests. Let's not call those clean or dirty, because your kids aren't dirty. You know, if they're positive for drugs, they're positive for drugs, but that doesn't mean they gave a dirty test and that they're dirty kids. I think it's important to speak in a way that doesn't scare them away from having the conversation. Next slide, please. So safe consumption sites, syringe exchange, important parts of harm reduction. The fentanyl test strips are something people can use if they're doing drugs that could be contaminated with fentanyl, so that they can test and see if it's in there. Preventing overdose. This is super important. If it's at all possible, don't use alone. So we talk to patients all the time that are still planning on continuing using. You can't administer Narcan to yourself. You've passed out, you're unconscious. So just having the Narcan is not gonna help you if you're by yourself. Anybody that has an opioid use disorder should have Narcan. And it's pretty frequently prescribed. If you go to an emergency room or see a doctor and they find out that you either have or have had an opioid use disorder, they'll probably prescribe it for you. And you can get it over the counter at the drugstore. Next slide, please. Signs of an opioid overdose. Yeah, you're gonna look for the snoring, agonal breathing, somebody that, you know, if you're shaking them and yelling their name and you can't wake them up. Pupils extremely small. Blue, if you see lips are starting to turn blue, that's usually a sign somebody's not breathing. I think the first thing, if I see somebody down and I think they haven't had an overdose, is I'm gonna check to see if they're breathing. It's, seems like common sense, but you know, I'm not gonna like call their name a million times to make sure that, see if they're breathing or not, and then give them Narcan. So let's see. Before you give the Narcan, you should call 911. I don't know if it says it on the slide here. It's just call 911 as soon as you find somebody that's overdosed, and then you do your rescue breathing and your naloxone. Next slide, please. This is a fun one. So which ones of those do you think are real? Like maybe 10%, 20%? 30%? All of them?
I don't know.
My memory serves me correctly. I think there's only one real pill in that group here. Let's look at the next slide. Okay, and there it is. So people buy pill presses, they're not that expensive, and they take those different color powders and they crush it into the shape of a pill, and it looks like a pill. Kids, I've met kids or young people that came into the ER that were hooked on benzos, like hooked on Valium, Xanax. And when they did the drug test, there was no benzodiazepine in their system, it was fentanyl. Next slide, please. Okay, so that's my team. That's our number at the emergency department, 573-2735. We work with Medi-Cal patients only, but we do give information. You know, we don't hang up on people if they don't have Medi-Cal. We'll give them some information on what to do next. We're there from 7 in the morning till 9 in the evenings. Next slide, please. So these are the drugs most commonly used by youth: alcohol, cannabis, tobacco, and then the over-the-counter medications like Robitussin, things like that, and MDMA, ecstasy. Of course, with a disclaimer that with the number 5 there's a good chance that what they're using is fentanyl again. I think this is where I hand it off to Michelle.
Yep, thank you. All right, so the California Healthy Kids Survey, if you aren't familiar with it, it's a survey that's done in middle schools and high schools, and I think some like 5th grade classes. I don't think it's super common though. Throughout the state of California, and it tests on a bunch of different topics, including alcohol and other drugs. So for lifetime use, this is data for Sequoia Union High, so this should be relevant to you guys. Lifetime use, the most commonly reported drugs were alcohol, marijuana, and prescription drugs. So that's anything that they've used ever in their lifetime. For current use, so past 30 day, alcohol and marijuana were the most reported substances used. Next slide, please. For AOD youth prevention programming here for San Mateo County, we focus on a few different areas. We do a lot of education presentations. So our contractors go into schools and youth groups and stuff like that, and they do presentations on alcohol, opioids, cannabis, whatever the school is requesting usually. And then we also do social media and public service announcement campaigns. We work with a group called Social Changery, doing all sorts of TikTok and activism through that. Our contractors do youth groups, so getting youth together, giving them something to do other than getting into things that they should not be, and teaching them how to be, sometimes they do like leadership stuff, sometimes they do conflict resolution, bunch of different topics there. Some of our contractors promote safe disposal program locations. So like we discussed earlier, the Rite Aids, county sheriff's office, can't remember all of the other ones. Policy work is a big one, looking at school suspension policies to make sure that they're equitable and make sense so that they don't overharm one subgroup of the student body. And then brief intervention, which is just a couple meetings with a counselor, and then you're out. So it's not super in-depth, just a 3-4 meetings to discuss and then hopefully not continue using if they are. Next slide, please. Youth mental health. So over the last several years, youth mental health has been a really big topic of concern for many different groups. So we've got a few articles and reports listed below. So in 2021, the American Academy of Pediatrics and several other groups declared a national state of emergency in children's mental health. There was a 2021 Surgeon General's report on mental health of children. 2022, Stanford released a study on pandemic stress and how it physically aged teens' brains several years. And then 2023, the Surgeon General's report came out on loneliness and isolation. So there's a lot of mental health stuff going on. There's a lot of things that our youth are going through that, you know, they shouldn't have to go through. A pandemic was so isolating and caused a lot of problems. So those links are there. I believe you guys have the copy of this. So if you want to delve deeper into these reports, I encourage you to do so. Next slide, please. Okay, so what can you do for youth? It's really important to create a trusted friend group that you can be yourself with and will support you in your decisions. It's important to have clear and firm refusal skills. You know, just say no, but it's not always easy to say no to people. So learning those skills and standing by them. Be okay to leave an unsafe situation. Talk with others about how you're feeling. Don't bottle it up. You know, find a trusted adult that you can talk to, whether it's a teacher or a counselor, a therapist, a coach. Like Mark said, never use substances alone. It can be very dangerous. And educate yourself with facts and accurate information. There's so much misinformation out there on social media. So having the real facts is very important. Next slide, please. All right. And then for parents, accept your child for who they are, have clear boundaries and communicate them clearly to your child. Know who their friends are and who their friends' parents are. So you know what they're up to and where they're going to be. Let them know that it's okay to feel however they're feeling and be there for them. Be present in their life. It's so easy to, get lost in all the stuff, but if you're there for them, it makes it a lot easier to know if there's a problem and to get help early. Next slide, please. All right, so for schools, it's really important to have a safe learning environment. Make it a safe space, make it okay to ask questions or make mistakes, no bullying. Consider your students' physical, social, and emotional needs. Have on-site services for mental health and substance use disorders if you can. Review your disciplinary policies to make sure that, one student group isn't more adversely affected than another, and ensure your school is prepared to address an overdose. So have teachers trained on addressing that with the Narcan and what to do. Next slide, please. So this is our Access call center. It is open 24/7. Mostly, I believe they do Medi-Cal, but like Mark said, they're not going to hang up on you if you don't have it. It's for substance use disorder help, getting connected to mental health services as well. I'm pretty sure they have heard just about everything at this point. So if there's something that is needed, they can probably point you in the right direction. All right, and I think that is our last slide. So thank you so much for all of your time.
Michelle, so we're ready for your questions.
Questions from council members? Juan Carlos.
Go ahead.
Going back to the Narcan, is that only given by prescription? Because I hear there's Narcan that's around for emergency purposes.
So it's the same Narcan that's prescribed is also now available over the counter. But you used to have a prescription to get it.
Does the county plan to have in the future, like at public places, Narcan? Because that's what's going on at schools and at, large places. Can you elaborate on that, what the plans are countywide, if there's any plans of doing that with Narcan?
So I don't know everywhere that they're planning on putting it, but I do know, for example, that they're gonna have like vending machines even at the courthouse and the jail where, and it's not gonna cost, I don't think it costs money. I think it's a free, okay. Yeah, we're trying to get it everywhere. Edith, I think has some.
And we have a list of where you can find them. If you have insurance, any pharmacist will write you a prescription and charge your insurance. And if you are a county client, you will get it for free through your provider. And we have locations where you can get them. And many of the libraries are trying to be a place where you can pick them up. So there's a lot of interest in getting Narcan available. Shouldn't say Narcan, it's just one of the brand names, naloxone, available in the community.
So as far as county facilities, you are gonna have some at the court, in the court jail, you said?
I believe, I hear the vending machine is being built as we speak.
Oh, great.
So
That is like a huge place.
You had a question, Kathleen?
I had heard it was gonna be pretty simple to get, like, anybody could go get it, so they had it in their bag if they ever saw anybody. It'd be that easy to get.
yeah, there's actually a website that you can go to
Okay,
that, depending on your insurance coverage, will make it available that way if you can't go somewhere. So everybody is trying to make it as available as possible. As I mentioned, you can go to a pharmacist and get it. If you have insurance, they will charge you insurance. If you don't have insurance, you have Medi-Cal, they'll figure that out. If you have none of those, it costs something like $50 at this point, which is a lot of money. But the county is trying to come up with a system where those would be available for people who need them. There's a prioritization for people who use, as well as people who might be around other people who might need it at some point. So we're wanting it readily available in case it's needed, because nobody needs to die from fentanyl overdose if we are prepared as a community.
Other questions from council members?
one more.
Go ahead, please.
The amount of fentanyl that you said could show up, how? I know some kids went to a rager. I'm like, okay, do you have a fentanyl test kit? Like, please, like, this is stupid. I know what you do. How easily does that test kit pick up that much fentanyl? If it were in a bottle, would they have to test every pill to,
Every pill. Yeah, because, and if the pills are homemade, there's gonna be different concentrations in each pill. Yeah, some might have none, some might have a lot.
I think the advice that Mark had given in red, the bottom of that one of those slides, do not buy your drugs on the
Yeah.
street or online, because it's almost guaranteed that it's gonna have fentanyl in it. If you're gonna get your medicine from your healthcare provider, those are appropriately safe. It's when you go outside of the medical structure and you go on the streets or you go online. Social media has very elaborate ways of allowing people, anybody, whoever they are, to have access to whatever drugs they might want. And so much of that supply has fentanyl.
Juan Carlos?
No.
Oh, okay. Any other questions from council members?
There's something I didn't bring up during the naloxone wears off. So when you do see somebody overdosing, call 911. If you've got the naloxone, that's great. But that's why you call 911 before you even give the naloxone, because the paramedics will have more in case whatever you give wears off. Because it might only last 30 minutes, 45 minutes, and if they did a lot of fentanyl, then they might begin to, it might catch up sort of, and they begin to overdose again.
And also a lot of the cases now, sometimes one shot of naloxone is not enough. So the recommendation is you have 2 on you in case that first one doesn't work, or it's not enough.
Is there a lot of overdose in the county?
Yeah, several a day.
Several days?
Yeah. We get alerts from the AMR, the ambulance service. And there's been some weeks where there was 7 or 8 a day. So these aren't necessarily fatal, but bad enough to require an ambulance ride and Narcan.
Are you doing similar presentations like this at the schools in the county?
Not me.
Prevention does.
Okay.
We go to schools and we talk about what people should do, the decisions that they make, because this is just about maybe fentanyl or opioids today. It could be something else, risky sexual behavior or risky driving behavior. So we talk about prevention just in general and making good decisions. But yes, we do a lot of alcohol and other prevention. And also Sequoia Union High School District is one of our closest partners that does a lot of education in the schools.
How prevalent is use of drugs and by drugs up to and including fentanyl, in particular in the schools? And has the percentage of students that are involved with that increased dramatically over the last 5, 10, 20 years? Just, if you give me a rough sense of how this is expanding, especially in the schools, but also, for example, in the homeless population as well.
I don't know that we have the homeless population information. We can find that out and get back to you. Our drug use rates in general are low in this county. The Healthy Kids survey that Michelle shared you earlier, those numbers are low. Our tobacco use rates are very low. We're only second to Utah in the lowest tobacco use rates in the country until vaping came along. And then somehow our tobacco use rate started to go up because vaping was just a kind of a fun, recreational, flavorful activity. But what it also did was it started to encourage or entice or bring people to the point where then they're using regular tobacco products. So our tobacco use rates have started to inch up. In general, our drug use is low. It is higher in our non-traditional schools or our continuation schools. It tends to go up as they get older, as you can imagine, among teens. And our concern is that drug use, teenagers, adolescents are going to experiment, push their boundaries. They're going to try different things. We want them to be able to try different things in a safe manner, make good decisions for themselves. And for those people who are likely to be, who are more likely to be addicted, and we showed kind of a slide of people who are more likely to be addicted. For those folks, we want to make sure that we give them information so that they realize the risk might be higher and what they can do to reduce the harm that they might be experiencing from drug use.
And what I don't expect you to get into a lot of detail on this, but what in particular is the county and county law enforcement doing to try to get this stuff off the streets beyond education?
I can't speak exactly for the sheriff's department. I don't know that immediately. However, I live in the city of San Mateo. And the city of San Mateo recently did a tobacco retailer raid of one store that had close to $200,000 worth of illegal flavored tobacco products. So law enforcement agencies, when they hear from community members that a retailer might be selling illegal products, they will act on them. Maybe not on the first call, but they do listen to community input. And so we have a tobacco education coalition that will let the police departments know and the sheriff's department know when they know something happening in the community. So it is something that is being tracked by law enforcement. Okay,
excuse my ignorance on this, but I heard about this in another actually in another call today. So the difference between legal and illegal flavored tobacco is what? Sorry.
In the state of California, as of January 1st of this year, my date might be wrong, Tim, retailers cannot sell flavored tobacco products.
Got it.
So
Okay.
it's just not allowed at all. So that store having any strawberry or mint or anything like that would not be allowed. But it is more common than we would like to think. Many stores are continuing to sell. This is why when we hear from members of the public that a specific store is selling, the first thing we do is we want compliance. So we as educators will go and let them know that somebody has reported that they're selling a product that they're not supposed to be selling, because it is statistically possible that they don't know the product is illegal. We want to give them a chance to comply.
Is there a buyback program going on for that or something, or are these people just stuck with
They're stuck.
inventory?
Whenever
Okay,
they sell, yeah.
because we're kind of doing that. We had some success with illegal fireworks. Fire department did a buyback to try to get them off the street. I don't know if the funding's available for that or whatever, but it would seem to be an interesting thing to explore.
We don't get that much money from the state for the work that we do. And a lot of distributors, honestly, we were hearing secondhand and third hand, that a lot of distributors were still giving the product to the stores to sell
Yeah.
because they make
It's in the
money.
chain.
Yeah, and also if you placed your order, you don't just order today to get the product today. You probably placed that order a month ago. And the state of California told you long in advance that these products are going to be legal as of January 1, 2023. However, sometimes the word doesn't get there, or people are not able to hear the word and they continue to sell it.
You said there was $200,000 at one
Close to
rate.
short of $200,000 worth of flavored tobacco products. That's a lot of product. That's not a couple packs
Yeah.
hanging around just lost. That's intentional selling. And we hear situations of how retailers are continuing to sell flavored tobacco products. For example, you don't see it when you walk in, but if you're a regular customer and you ask them for a specific thing, sometimes even when you're not a regular customer, when you ask for a specific product, they'll go to the back and get it.
Other questions from council members? Do we have any public comment on this agenda item?
There are no.
No public comment. Okay, well, thank you both very much. Very educational. I certainly learned a lot. So, thank you both very much.
Thank you.
That concludes our agenda tonight. Thanks to the presenters, the members of the public who attended, county staff, Kenny, Jennifer, Bo, Tim, thank you very much for your attendance this evening. Our next meeting is a regular session 1 week from tonight, 7 to 9 p.m. right here. With that, we are adjourned.